I'm Ashley Crosby, and this is my med administration video. We're going to start with the injection landmark sites. We're going to go with the ventrogluteal first. So she is laying on her left side, and her right hip is up. So I'm going to place my left hand on the greater trochanter area. She can move her leg up and down for me to find the joint. So my thumb would want to point towards the groin, and my index finger would want to point towards the axillary, and I would want to move these 3 fingers back. I would want to be feeling for the iliac crest, and I would place the injection site in the triangle area. I could use an alcohol prep pad to mark the site, but I'm one-handed right now. So next we're going to go to the vastus lateralis. She can stay in the laying position. So I place my left palm back on the greater trochanter area and feel for the lateral femoral condyle with my right hand. So we're going to go down here. The hand would go above the knee. We would want to find the protruding area. So the hand is above the knee, and the thumbs would make the bottom line for the injection area, and we would want to be in the middle of the rectangle. So it would be in this area. Okay, next we're going to do the deltoid. So you would want to push up the sleeve, and you want to feel for the acromion process, which is going to be at the top of the arm. You're going to place your pinky on the bone and then lay the 4 fingers down. You are going to want to move your index finger downward to make a triangle, and in the middle would be your injection site. Sometimes you would have to pinch the site if they're older. You could pinch from the top or the bottom. Next, we're going to do the intradermal injection site. So you would want to go to the elbow joint where it bends and place one hand, and then the other hand would go above the wrist. So the injection site would be right here. You would want to find somewhere that's not real veiny, doesn't have any bruising, no trauma or hair, and we would go right in the center. Okay, so the next part we're going to do is the medication administration, and we're first going to look at our orders, and we are looking at the allergies, and we have none for Mr. Doe. So next we're going to go to the actual med prep. We're going to start by hand hygiening and gathering our supplies. We have our Band-Aids and prep pads for in the room. We have our bags with labels for each med. We have our syringes. We have our prep pads to clean the medications. And we have the insulin, the NPH and regular. We have the TB, and then we have the Rocephin. We will want to compare the meds with the MAR and also do the rights as we go. So our first thing that's been ordered is the insulin for Mr. Doe, and we want to make sure it's the right person, the right drug, the right dose, the right time, right route, and make sure that it's not expired. So our insulin doesn't expire until 2/29 and 2/28. So we are going to make sure the ingredients are mixed. We don't want to really heavily shake the medicine. So then we will want to clean it. We are going to use the orange capped syringe. And first we'll start by injecting the air. So the MPH will get 10 units of air. Okay. You'll go just directly in the center and inject and pull out. The regular insulin will get 5 units of air. And then we will inject. And this is where we will turn it carefully, not bending the needle, and we will draw 5 units of liquid slowly and pull. And then we will place it again in the MPH and pull out 10, which will make it 15. Going slow to get no bubbles. Pull. No bubbles, and then we will want to scoop. And then we will want to place it in the bag. And we will also check again to make sure this is going to Mr. Doe. And we have our label. It has the 15 units all together, and we're going to be giving this sub-Q, and we're going to be doing it in the abdomen. The next thing we're going to do is the Rocephin. We have an order for 500 milligrams per ml, and it's going to be IM for Mr. Doe. We've compared the medication to the MAR, and our expiration date is December 2020. So we are going to start by cleaning it. We're going to make sure to use a filtered needle. So we're going to pull our 1 ml of air and inject. And slowly draw the 1 ml of Rocephin. Making sure there's no bubbles and that we have enough. Okay, air bubbles are out. And we are at 1 ml. We are going to scoop and recap, but then we are going to change to the regular needle. Throw away in the sharps container. And this is ready to be placed in the labeled bag. And again, we're going to compare the order to our label, 500 milligram per ml IM for Mr. Doe. Okay. And then last, we're going to get our TB test. So we're going to use the red cap. First, we're going to clean it. While it's drying, we're going to compare it to the MAR. We're going to get 0.1 ml, and we have plenty. The expiration date is 2/29. So we're going to uncap. We're going to the 0.1 of air. And we're going to push, inject, gently flip, and slowly draw. Okay. And we have our 0.1 ml. We are going to scoop the lid, cap it, and we're going to place it back in our bag, comparing the label to the mark for Mr. Doe, 0.1 mil. And we're going to be giving this in the right forearm. Okay. So now we're going to go into the patient's room. We would knock. We would go in, we would hand hygiene, and we would ask for the patient's name and date of birth. And he would tell me his name's Jonah Doe, 62255. I would ask if he had any allergies, and he would say no. So now I'm going to get ready to give the medications. I'm going to hand hygiene since I set all my stuff down, and I'm going to put on some gloves. So the first thing we would give to Mr. Doe is going to be his insulin. We would explain why we are giving this to him to help him with his sugar levels. So we would compare. It is for Mr. Doe. It's going to be a total of 15 units. NPH is 10 units and regular 5 units. And we're going to give this sub-Q at 8 o'clock, right upper quadrant in the abdomen. So we have our insulin. We have our prep pad. So we will prep the area. And for sub-Q, it can be given 45 to 90 degrees. I'm going to go in at 90 degrees. So it would be a quick stick. And we would stabilize and press with the dominant. Go in slow. Hold. And then remove. We would apply a Band-Aid if there was any bleeding. And we would dispose in the sharps container. Next is going to be the Rocephin. We're going to compare it. It is for Mr. Doe. It's 500 milligrams per mil. And it's going to be IM. And the 3 mil needle, which we've already changed it over. This is going to be in the ventrogluteal. So, in the right ventrogluteal. We're going to prep the site first. This is going to be given at a 90 degree. And we're going to displace. So we have our needle. And we're going to do a quick stick. We will aspirate. We will see that there is no blood. And then we would slowly inject. 10 seconds per mil. We would hold for at least 10 seconds. And then when we remove, we pull both hands at the same time. Activate the safety. And place in the sharps container. Last, we're going to be given the TB test. We're going to compare it. It is 0.1 mil of tuberculin. It's only 1 dose. We would educate that this is for him to get into the nursing home. It's going to be in the right forearm, and we would check this within 48 to 72 hours. And it is for Mr. Doe at 9 o'clock. We would prep the area. We have bevel up. There's our bevel. So we're going to go in at a 5 to 15. We're going to make sure everything's stable. And then we're going to slowly inject. We have our small little wheel. We're going to pull out. And there fluid starts to drain, that's okay. And we will dispose in the sharps container. We would tell the patient not to get anything on it. We cannot put a Band-Aid on it. Don't put any lotions or creams. Dispose of our gloves, and while we're hand hygiening, we would make sure that everything is cleaned up. He's in the lowest safe position, and ask if he needs anything. Call bell is within reach. This is the documentation portion. So for the sub-Q given at 0800-420-2020, there was a finger stick sugar of 162. There was insulin NPH 10 units and regular insulin 5 units administered sub-Q in the right upper quadrant of the abdomen. No bruising noted. Bed locked at lowest position with the side rails up ×2 and the call light within reach, and reminded patient to call for assistance to the bathroom. Signed, A. Crosby, SRN, BSCC. Next is the intradermal 4/20/2020-0900. Explain the purpose of the skin test. Patient verbalized an understanding that the test was necessary to be accepted into the nursing home. 0.1 ml of tuberculin, lot number 427 PW, was injected ID in the right forearm with a 1-inch circle drawn around the bleb. No reaction noted 5 minutes after injected. Informed patient to be read on 4/22/2020. Instructed patient not to scratch, apply lotion or cream to the site. Do not scrub the site or apply a bandage over it. Bed locked at the lowest position with the side rails up ×2. Call light within reach, and reminded the patient to call for any assistance. Signed, A. Crosby, SRN, BSCC. Last would be the IM injection given on 4/20/2020-0910. The Rocephin 500 milligram per ml administered IM in the right ventrogluteal site. No complaints of pain, numbness, or tingling. Bed locked at lowest position with the side rails up ×2. Call light within reach, and reminded patient to call for assistance. Signed, A. Crosby, SRN, BSCC.